welcome again to the session on discussion on the topic chronic kidney failures. So in our previous session we just learned the diagnostic tools as well as the modalities of treatments available in Ayurveda on how to manage the chronic kidney disease. So as we learned in our previous session that there are many disease entities mentioned in Ayurveda which can be correlated with the modern chronic kidney failures. So sir has already explained to us that it cannot be compared with the Ayurvedic disease entities as mentioned in Ayurvedic text. But still I would ask sir kindly please suggest as per your advice that what are the different disease entities which are mentioned in Ayurveda by which we can correlate it with the modern day chronic kidney failure.
Yeah. So, dear Dr. Gurmeet, actually, few things I have already explained that how to understand this disease in Ayurveda. But to make it more clear, as I told you earlier also that we are very much stuck to our classics. That is wonderful. We have to be. That is our basis from which we have to evolve ourselves. But I often thought about the descriptions in classics and the limitations in there. If we think that Bhratra is enough, then what was need of Lavapuri? If we combine both of them, then what is need of further textbooks? Here I would like to quote Kaviraj Gannath Singh, who has written a wonderful book, Siddhant Nidan. When we were student, it was in our curriculum also to go through this book. And this was good attempt by Kaviraj Gannath Singh to think about newly appeared diseases according to Ayurvedic principles. And in that book, actually that type of effort should be continued. Unfortunately, today's students are not aware about this book and this effort. In this book, in the introductory chapter, Gannath Singh has written one beautiful sloka. Purana priviliyante navina pradurasate vividhyante stitaschat nanam nana vidagada. That means the diseases which are described earlier, now they are vanishing. And some new diseases are appearing. So the learned scholars have to understand them, these modern diseases, according to their own wisdom. And this is what Gannath Singh has done. In this context, I would like to draw your attention on one more thing. Bhav Prakash has described Firanga.
Yes.
If earlier texts were enough, then why he has coined a new word or a new disease which he has explained in his time? He would have also, he could tell this, he could write this, that this disease which is known as syphilis in modern time can be correlated with this ancient text. But he has coined new word for that. That is Firanga.
Right.
In Bhesaj Ratnavali, also the Vedyas, I don't say that it is originally from Govindas, the original author of Bhesaj Ratnavali, but other editors have included kidney diseases as appendix later on. So, it is my strong belief that we have to understand modern diseases. If we can find similar disease entity in classical text, it is wonderful. But if we do not find, then we should not try to just keep some disease entity like a ready-made garment, whether it is fit or not. But if you have paid for that, then just try to put on your body. If it is matching exactly with this, and then another criteria for this, that the treatment which is described for that disease in that text, if it is useful for that disease, then we can say that yes, this disease is similar to this. For example, rheumatoid arthritis. Though in this also there are a lot of differences. South people think differently, North people think differently. But still, in my own observation, I found that in rheumatoid arthritis, the treatment which is described in text for Amavata is working very well. So with whole its etiopathogenesis and its mode of treatment, now I dare to say that Amavata is similar to modern disease entity of rheumatoid arthritis. There may be some other diseases also.
Right.
Again, Amavata is a group of disease. We can say that so many disease entities we can treat according to the principles of Amavata. But at least one disease which we can say that rheumatoid arthritis is very much similar in etiopathogenesis, in symptomatology, and in its treatment modalities.
Right.
So again, I will like to repeat it so that it is clear that this chronic renal failure or CKD, we cannot compare with one disease entity. We have to understand it through several disease entities and mostly according to the involvement of disease components, samprapti ghatak, like doshas, sotas, and other factors involved in that. Again, see, this is also I observed that in Ayurveda, organ-oriented descriptions are not much.
Right.
Hardly you will find, for example, Gren, it is organ-oriented. Khadro, organ-oriented. But same time, cirrhosis of liver, this condition. In Ayurveda, they have emphasized more on kliya. Liver was secondary there. In modern time, liver is prime. Kliya is secondary. So it is possible that in those days, it was not very important for them. Now it becomes important. So here also they have not given importance to kidney in this context. Here also there are several vitandas. For example, that people say that in Ayurveda there is no relation of mutropatti, urine formation, with kidney. I say Ayurveda has given you 3 pramanas: Pratyaksha, Anuman and Aptopdes. In Aptopdes, if it is not mentioned, then you have to first follow Pratyaksha and Anuman. Remove anybody's kidney. If in human beings you cannot do it in anyone's. Or just claim the kidneys and then see whether urine is there or not. Naturally, there will be no urine. So it proves that if clamping the ureters or removing the kidneys, resulting into non-formation of urine, it means urine is produced from the kidney. You can say that in Ayurveda it is described that it is produced from Pakvashaya. Yes. But reality is this, that we have several patients of ulcerative colitis. We also have patients in whom the colon is totally removed. Suppose somebody had cancer of colon, the whole colon is removed and they put a pouch here on the abdominal wall. So there is no colon, no Pakvashaya, but urine is produced. That means physiologically there is no relation of Pakvashe in producing urine. So what is this description? Remember, in Ayurveda, the language is very much coded language.
Right.
When they said Mutrotpatti from Pakvashaya, that is a code that when you need therapeutically, when there is no urine formation from the kidney and you have to produce it, then go through Pakvashaya, go through Polo. So that I understood and that I take an idea for my treatment. Now you may go ahead.
Thank you, sir. Certainly, you have given a nice advice on this topic, a point of discussion, because as we know that in Ayurveda, different perspectives are seen when we take into consideration the treatment part of the patients, because every patient has a different prakriti, every patient has a different sar and samhanana. So naturally, that management of the kidney disease should also be different. So continuing with the management part of our chronic kidney diseases. So as we know that there are different modalities as mentioned in Ayurveda. Some are Shamana Chikitsa, some are Shodhana Chikitsa. So now we are going to discuss on the Shodhan Chikitsa, which is mentioned in our Ayurveda. Sir, what is the role of Panchakarma in the management of Brokka Vikar and how to start it? What is the role of Basti Chikitsa and all other therapies as mentioned in Panchakarma?
Right. See, Panchakarma is a group of therapies which is very important component of Ayurvedic treatment plan. But it is not always essential. For me, Panchakarma means these 5 therapies. For me, Panchakarma is not the manual therapies which are very popular, like Abhyanga and Sirodha.
Right.
Vamana, in these patients we never go.
Okay.
Because Vamana is often require, not often but always require strong Bala. And in these patients, Bala is already lost. Therefore, Vamana is not possible in these patients. Now we come to Virechana. Of course, in mild form, we are also having some research project now on Virechana on these patients. That in mild form, around below 3 milligram percent creatinine, we try to give them Virechana. Then we are observing that what is the difference if we give Virechana or we do not give Virechana. And results are good, so we can say that Virechana helps in these patients. Then comes Bastis. And as I told just now, that for me, when we say Mutrotpatti from Pakvashaya, I mean therapeutic Mutrotpatti. And that this principle I use here, I give in these patients mostly Nirodhas.
Right.
And that helps. When patients feel more weakness or abdominal cramps or this, then we give periodically Anuvasana Basti or Matra Basti with we have prepared our own oil in which we processed sesame oil with all rasayanas like dokshu acting on Mutravas. So with that oil we give Anuvasana Basti. But our main Basti is Astapana Basti. And in that we prefer to give Punarnavashta because is base material.
I still remember that.
Yes, nice. Then comes Nashya. Usually these patients have a kind of depression, anxieties, because of that often sleeplessness. So in these patients we give Navana Nashya with Brahmi, and that helps. So, Panchakarma not as a whole, but of course, Basti is main component of our whole treatment program, and sometimes Nashya. Now, Virechana, we are studying whether it is useful or not, and if it is useful, then to what extent.
Thank you, sir. So this is all about the Panch Karma, in which sir has mainly mentioned the use of Basti Chikitsa in managing these cases. Now coming to
In this, actually, in Basti, I would like to add one more thing. That when we give Basti, we try to have its retention time minimum 20 minutes, so that its action on the colon can be optimum. Usually in Neurovasti, what happens that you give Neurovasti and it comes immediately out. That will not be that useful. Let Basti act on the colon wall, because then its action will be there.
Thanks. So coming to our next point, as we know that there are many clinical manifestations which are seen in chronic kidney diseases as well as kidney infections. So there is a condition, sir, of proteinuria which is mainly seen in the CKD. So what is its Ayurvedic perspective and how do we see it and what is its management?
See, proteinuria is indicator of some damage in the basement membrane of the glomerulus. So, even if there is no CKD, CKD may develop later, but even if proteinuria is there in the urine, that is indicator of some damage in the kidneys.
Right.
As I told you in the beginning of our discussion, that proteinuria, the description of proteinuria, we can correlate with the description of salmonella. But as far treatment is concerned, when it is main feature proteinuria which happens in nephrotic syndrome, when there is huge albumin loss is there from kidneys, there our approach is little different, where we concentrate more on to have this to diminish this loss from the kidney. Otherwise, we consider this also as part of whole pathogenesis. So when we treat the patient of kidney disease with the plan as we discussed earlier, that also help in the treatment of protein. So there is no need of additional consideration.
Okay, sir. Now our next point is, as we discussed about proteinuria. Similarly, there is a condition in this kidney disorder. Patient manifests with different edemas in different parts of the body. So how do we differentiate between a normal edema as well as edema due to the kidney disorder? Is there any peculiarity?
For edema, there are several causes. It may be whole body edema, it may be on some particular part, sometimes it may be even unilateral, it may be unilimbic like this. So that may be different, but in relation to kidney, this is usual, that means commonest sign which we study in the medicine is that edema which is related to kidney is primarily manifest first on the face, particularly paraorbital edema. That is specific for kidneys.
Thank you, sir. So coming to the treatment part of the kidney disorders. So as we know that we have in Ayurveda different medicines are used like Ras Aushadhis, Dhatu Bhasmas, which is adopted in Ayurveda in the later time as compared to the Pravatrai and Navutrai as we have seen. So modern science advises to avoid use of heavy metals for treatment purposes. So, as per your advice, is it safe to use heavy metals or the drugs like Sarvatobhadravati as mentioned in Ayurveda?
See, we cannot say that conventional science or allopathy is wrong. Of course, heavy metals are toxic. We cannot ignore this. In their chemical form, they are harmful. But in Ayurvedic processing, the form of these metals is quite changed. In heavy metals also we have to consider that certain heavy metals are necessary for the body, certain not. And certain metals which are useful for the body, that you have to take them, that is essential. But heavy metals, those are considered toxic. They are mercury, lead, cadmium, arsenic, these. As I observed, copper, silver, these things, they are not at all that. Of course, if you take in big dosage, anything can be toxic. But they are essential, essential nutrients also. So those are not harmful.
Right.
Now, in this context, I think Vesaji Ratnavali is the first text which have described this disease separately as blood recurrence, and which the tablet which you have mentioned, Sarvatobhadravati, it is described there.
Yes.
In that chapter also, they have clearly warned that Rasodhis can damage the kidneys. Therefore, Vedyas should not use it. So, for Rasaj means particularly for mercurial preparations, they have also warned. So, if Vedyas of that time of Vesaji Ratnavali, they have observed that these things are not good for kidneys, so that cannot be wrong. And practically also we observe that these preparations from mercury, lead, arsenic, they are not good. But we are often using Abrak Bhasm in so many patients. Low, we are using Tam, we are using Yashad, we are using. So these we did not find harmful in recommended doses.
Okay. Sir, with regards to this Sarvatobhadravati, as I have came across the reference, it was mentioned in Kayachikitsa, not in the Brakavika. So why Vesaji Ratnavali has...
See, Gurmeet, you are mixing up.
Yes sir, I am just mixing because...
Yes, I tell you, in Jwar, nice. Just, I will take your 1 minute. Nice that you have clarified this. In Kayachikitsa, the medicine which is described is Sarvatobhadra Rasa.
Okay.
And in the Virakka Vikara, the thing which is described is Sarvatobhadravati. In Sarvatobhadravati, the ingredients are Swarna, Rajat, Abrak, Loh, and Gandha, Makshi. While in Sarvatobhadra Ras, it is Parak. This is the difference. Often people confuse with this and write Sarvatobhadra Ras, but Sarvatobhadra Ras is not for kidney. Sarvatobhadra Rasa is for Jwara, and that contains mercury.
Okay.
Sarvatobhadravati does not contain milk.
Right.
This is the difference. And that sloka which I mentioned, in Raso Vivardiyet Vyadim Atar Atam Na Hi Yojiyet. It is from Vesajaratna. That Rasos these increase the severity of the disease, therefore they should not be used.
Right. Thank you for the explanation and clarification of this confusion. So now I think the Vedyas would
Because see, if you see this Vesajaratna, there are so many yogas with similar names.
Right.
And often it causes confusion. If you do not remember the actual ingredients, then because now you are in a pharmaceutical company, you may be knowing that even Singnath Guglu has different parts.
Right.
Chandraprabhavati, different part.
Right. Even Swarna Bhasma has different methods of
Methods, yes, of course. So, which one we use, that we have to decide and make according to that methodology.
Right. Thank you, sir. And now coming to the next point of our discussion. So as we discussed the use of Dhatu Bhasma in kidney patients. Now, if there is a pregnant woman or lactating woman is involved with this kidney disorder, how is it safe to use the Dhatu Bhasma in these patients?
Actually, to be honest, we did not have any experience with such women until now. That any woman who is lactating or having pregnancy came to us for the treatment of kidney failure. But in normal healthy women, these nutrient metallic preparations are often used.
Right.
But when you have doubt about the quality of rasa preparations, and if we have other options, then in such conditions we should not. Because we do not know
Right.
if Bhasma is not properly prepared and if it is deposited in the body somewhere and it causes some effects in the fetus, then it can be a big problem for the life of that child. So when you have doubt about and when it is not much necessary, better to avoid such things. But as far as kidney is concerned, we did not have any such patients in our practice till now. Every year we register more than 500 patients of kidney failure. But it is coincidence that not a single patient who is pregnant and lactating came to us and having treatment.
That means it is a rare case to find. That is why
It is also possible that those women did not come to us, tried to have modern treatment. Only one lady, now I remember, only one lady came to us. She was, she already had kidney failure and we warned her not to have pregnancy.
okay.
But as you know, in India, in-laws are always, whether the बहू की जिंदगी बची या नहीं बचे, लेकिन उनको तो वंश चलाना है.
Right, sir.
So in that lady's case also this happened that they insisted and she became pregnant and it was very bad situation. Now probably she's on dialysis. They have to terminate pregnancy also.
Okay.
So in such cases, it was only one case which we have had. But the lady was already suffering with kidney failure and she became pregnant.
Very nice, sir. Then, as most of our Vedyas are curious to know as to how which Raskalp or which Bhutivati can be used which can break down the creatinine level. So just any name of the raskalpas or any preparation.
See, creatinine is indicator. To bring creatinine down, creatinine can be down with other things also.
Right.
If you do not do any activity, creatinine will be down. Because creatinine is waste product from the muscles and which is excreted from the kidneys. Now if you give rest to muscles, it automatically will go down.
Right.
Now you feel, oh, now my creatinine is down. But that is not the criteria. Your kidney function must be improved. And for that, see, we do not have any fixation for any classical product. As I told you that we have to approach through this disease pathogenesis components. So, any medicine which is rasayana for Mutravasotas and the preparation made from that, you can choose. For example, Gokshuradi Gugu. If you want to have a name, Gokshuradi Gugu, you can use that. Shilajatwadi Vati, that you can use. You can make your own preparation with several combinations. You can give Shilajatu alone also. You can give Gokshur alone also. You can make extract of Gokshur and that you can use so that you can give big concentration. So you can design your own method. Basic things I have told you.
Right.
I cannot say that what I am doing is only science. Strategy I have displayed. You can plan accordingly.
Right.
We do not want, means it is not to hide that what we are doing. We published everything. Whatever publications we have, in that we mentioned everything. That these are our medicines we use. Gokshur, Bhumi Amargi, Varona, Shilajatu, all we have mentioned. But if we mention that you use this, and suppose that preparation is not of good quality, no result, then you will say, oh, it is not working. So, basic structure of treatment is this. According to that, you can design.
Definitely, sir. So, we are thankful that you have shown your advices on the use of this rascal and what should be the treatment modalities. Now we have also come across patients who are taking allopathic treatments also.
Yes, good.
So, is it possible that we can continue the Ayurved treatments also along with the allopathic?
Yes, very good question. It is very necessary. See, in that we have to observe certain medicines are essential. We cannot ignore. If we have good substitutes for them, then we have to do this, of course. But if we do not have substitute, then we have not to play with the life of the patient because of our dogmas. For example, if patient is insulin dependent diabetes, we cannot stop its insulin. Our goal is to concentrate on his kidney function. Let insulin play its role for controlling its diabetes. But if we feel that there is no need of insulin, we can manage his diabetic condition also with our system. Sometimes, as we start the treatment, we feel that need of insulin is gradually reduced, so we can stop also. So don't give any allopathic medicine unnecessarily. Same times, because of our dogmas, we have not to stop certain things, those are essential. Blood pressure, it is always a problem in these patients. Sometimes, even with allopathic medicine, it is difficult to control. So we try to control blood pressure with our own medicines. For example, Arjuna, Iflagubi. It works well, but sometimes it does not. Then we call the physician. We discuss with him and we find the safest medicine from conventional medicine which can help the patient. Certain things like vitamin D3, because kidneys are not able to activate vitamin D, and if you do not do this, then there is problem with calcium metabolism. So if there is no substitute for vitamin D3, we allow patient to take it. Of course, we are working for substitute for that also. But at present, we cannot tell you that it can be real substitute. For certain things, we have found substitutes. For example, erythropoietin, which is produced in the kidney and which is necessary for erythropoiesis. Liver can produce erythropoiesis, but very less amount. So now in these patients, not exactly like erythropoietin, but we have found certain other plant products. Those can help similarly. For example, beetroot. And there is one fruit from medicinally like plant that is known as prickly pears. That we are using. Not 100% substitute, but a good substitute. Similarly, we are working also for substitute of vitamin D. Maybe we will succeed in that. They give cell call calcium preparation. No need to give this. We have better calcium with us. Give the preparations of Gupta. You have triple advantage if you give it. You get good quality calcium. Gupta is also helping in reducing the acidity, which is also a very common problem with these patients. And third, Gupta is very good antidepressant. And in these patients, depression is very common problem. So in spite of cell call, if you use Gupta, you will have triple benefit.
Thank you, sir.
So these medicines, which usually face diuretics, sometimes they are useful, sometimes not.
Mm-hmm.
So if they are not giving any benefit, we stop them also because it has other side effects. So another thing, very often these patients come with statins. And statin is such a drug which blocks the production of coenzyme Q10, which is very essential enzyme for all the vital organs. So just to reduce the cholesterol, if you take this, then it has more problem to damage these vital organs. So in the patients where there is no big need of these statins, we stop that also. Of course, we consult modern physicians. We have modern physicians also in our team. We discuss with them that up to what extent something is essential, up to what extent something is non-essential. For us, patient's life is important. We are not dogmatic that Ayurveda means only this. For me, anything Ayurvedic which can save the patient's life. तदेव युक्तं भोस्त्वेषज्यं यद आरोग्याय तद्भवति. Anything which is properly used and giving health, that is the real medicine.
Definitely, sir. So we are very happy to know this that Dr. Gupta sir is working on such an innovative ideas through which we can bring in various Ayurvedic herbal formulations as mentioned in text, which can be used to manage the complications as found in the kidney diseases. So coming to our last point of discussion, sir, what should be the anupan vichar, what should be the ahar vihar of kidney disease patients?
Ahar vihar we have already discussed.
Yes, sir.
As far anupanas are concerned, we can choose anything. See, in these patients, anorexia is one of the problems. And if you give something which is not giving good taste, then that appetite is again diminished. So you have to choose any drink or any supportive nutrition which on one hand be nutritious, same time it should be tasty, and also should be according to the disease components those are involved, and having no adverse negative effect from the treatment which you are giving. So a limited amount of milk you can use in these patients. Sometimes when patient has always nausea type of thing, we encourage them to take some, phenols. You just put phenols in the water and sip it. It gives pleasant sensation. If patient is non-diabetic, then he can add some sweetening agent also in it. Maybe little honey, maybe little jaggery or some sugar. It gives pleasant sensation. So these type of drinks you can suggest. Of course, here you have to take care of how much fluid you have to allow to the patient. Within that limit, you can permit these things.
Definitely, sir. So this is the most important thing which we need to keep in mind, that we need to know how much fluid intake his patient is having, because this is the only main problem which a patient is facing. So with this, sir, I would like your permission to conclude the session.
A few more additional information I would like to give you.
Yes, sir.
Because nowadays it is era of evidence-based medicine.
Correct, sir.
For me, these Sanhitas are themselves evidence. Whatever they have written in these classics, they have not written under some cannabis intoxication.
Right, sir.
And the authors of these ancient texts are much more honest than the modern scientists. So for me, the evidence which is there in our classics is better evidence than any article published in modern journal. But still, as Ayurveda says, that you have to go according to Deksha and Kala. So the Kala says that anything which is published in modern journals, that is evidence. So we also have our publications in several journals. Recently, we have published, it is maybe last year, we published one article. It is very important to know that usually people say that there must be controlled trials. Now in such patients, those are hemmed between life and death. How you can give any control, particularly placebo control, or any control which is not known? You may be playing with their lives. They come to you for treatment, and you cannot keep them on placebo. So we designed our own study in this. What we have done that in year 2000, just a minute. In 2015-16, we have chosen 53 patients. Those had their previous medical records. And in those patients, we have taken their status of renal function 6 months before when they came to us. For example, if they come today to us, 6 months before, how was their status of renal function? Means particularly their eGFR, creatinine, etc. Today they started our treatment. After 6 months, when they took our treatment, how was the response? So just in brief, that we found that in these 53 patients, 6 months before when they came to us, their EGFR was around 20, mean average, 20.5 something. When they came to us, it was 11.9. That means when they were taking conventional treatment, their renal function went down. EGFR is indicative of renal function. And when they took our treatment for 6 months, it went up again to 70. That means when they were on conventional treatment, their condition was deteriorated. But when they took our treatment, means Ayurvedic treatment, the condition was improved. So it itself is evidence that Ayurvedic treatment is helpful in these patients. And this article we have published in very famous journal of Alternative and Complementary Medicine. In this, some of our friends from Charity Medical University Berlin also took part. And it is published in 2019. In the May, no, it is actually published in 2020, May 11. So, this is something important for the persons those are interested in scientific studies.
Definitely, sir. This is
Any
important.
further question?
Nothing, sir. That is all. If you have anything more to show us,
Yes. Now we can show some patients to you
sure, sir.
so that. Yeah.
Thank you.
I think you also had some question related to diuretic.
Maybe possible, sir, because we have included that topic previously.
Here, because it is also necessary, diuretics cannot help in these patients. Actually, this is also very important to study that whether our Ayurvedic mutral drugs, what is their mode of action. But as such, we did not find any specific role of them. As far conventional diuretics are there, they all work on the renal tubules, either antagonizing vasopressin or interfering with the reabsorption of the electrolytes. None of them act on the glomerular filtration. What we need is any substance which improve the glomerular filtration that can help in these patients. And glomerular filtration cannot be improved just by substance because the glomeruli, the filtration unit, which consists of basement membrane, endothelial lining, and these pedocytes, this is damaged. So anything which can repair this filtration unit, that can help. So in general, diuretics cannot help much in these patients. Only when there is water load in the body, accumulation, that can be reduced because these are diuretics, they excrete the water.
Right.
So they, in Ayurvedic terms, they act on Udat Vasanas, not on the Mutra Vasanas.
Right.
We need the things which act on Mutra Vasanas.
Right.
So, thank you, Gurmeet, for your interest which you have, because your interest is beneficial for Ayurvedic community. That people can start thinking on these lines. We cannot say that what we say is final.
Thank you, Dr. Gupta, sir, for the vivid explanation of the topic. And it was indeed an experience that you have explained through the practical examples and taking the cases of the patients which visit our the PD Patel Ayurved Hospital, and to all the staff of the PD Patel Ayurvedic Hospital who has supported us in recording this lecture session, and it certainly has provided us wisdom and knowledge. Thank you, sir. Shree Dhootapapeshwar Limited cannot be more thankful to the keynote speaker, Dr. S.N. Gupta sir, for giving us the valuable time from their busy schedule and explaining us the topic chronic kidney failure in Ayurvedic perspectives. And to all the doctors who have participated in this talk session and making it a grand success, thank you, and do continue your patronage to Shree Dhootapapeshwar Limited. Follow us on our Facebook page to stay updated for the next topic of discussion, and we expect your same affection in the next lecture series too. It will be yet another rich clinical orientation bound session wherein some new aspects of Ayurveda diagnostic methods and treatments shall be revealed. For further updates, log in to our website www.sdlindia.com, or you can also write us on healthcare@sdlindia.com. Thank you all for the participation. Till then, this is Dr. Gurmeet Singh Saluja saying goodbye to all of you. Take good care of yourself. Namaskar.